Have you ever felt that talking about masturbation in your old age is taboo? Or maybe you secretly do it, hoping no one finds out. If you're over 60 or have aging parents, this video could be the information you never knew you needed. Many seniors feel that masturbation is a safe and natural way to release tension or loneliness. And it's true in many cases, it can be beneficial. But did you know that there are common mistakes that are often made, which seem trivial but can silently harm health? In fact, some of them can trigger serious problems such as heart problems, infections, and high blood pressure. And unfortunately, they are rarely talked about openly. So if you care about your health or that of your loved ones, watch this video. Because in this video, we're going to expose 7 masturbation mistakes after the age of 60 that can secretly be fatal if they continue to be ignored. Over the years, I have witnessed how the topic of sexual health, specifically masturbation in old age, is one that is most often avoided, even by the most open patients. Yet it is precisely out of this ignorance that many health issues arise, and unfortunately, are often already in quite severe condition when treated. One of my most memorable patients was Mr. Richard Thompson, a 67-year-old retired Navy veteran from El Paso, Texas. He came in with severe insomnia, often waking up with palpitations at night and feeling tired throughout the day. For months, he had been seeing various doctors, being given sleeping pills and supplements, but nothing was improving. Until one day, during a private consultation session, he finally revealed that every night before going to bed, he used to masturbate as a way of relieving stress and loneliness since his wife died 5 years ago. Many people Mr. Thompson's age don't realize that their bodies no longer react the way they did when they were 30 or 40 years old. In old age, changes in hormones, skin elasticity, nerve sensitivity, and conditions of internal organs such as the heart and prostate should be considered in any sexual activity, including masturbation. Unfortunately, due to embarrassment and the assumption that it's a private matter, most elderly people choose to keep quiet. They find their own way, following old habits, without knowing that it could be harmful. And it's not just men. Many older women experience discomfort, infection, and emotional guilt because they were never properly informed about healthy sexuality in old age. That's why this video is not meant to be judgmental, but rather to open up a space for honest and respectful conversation. Because sexual health is an important part of quality of life, even after the age of 60. If you are an older person or have a parent or relative who has reached this age, I hope you will take this information with an open mind. Because it could be that what you learn today will make a big difference in your life or that of someone you love. Here are 7 mistakes that many seniors make when masturbating. 1. Doing it too often to relieve stress. Many seniors feel lonely, especially after losing a spouse, retiring from work, or when children have moved far away. At such times, masturbation is often used as an escape, a way to seek comfort, a distraction from loneliness, or even a substitute for lost emotional interaction. In reasonable doses, masturbation can be a means of channeling biological needs and maintaining psychological health. However, when it is done too often as an uncontrolled emotional outlet, it can actually have a negative impact, especially for those over 60 years old. In old age, the body is not as flexible and resilient as it used to be. The nervous system becomes more sensitive, hormone levels decrease, and the energy recovery process is much slower. Frequent masturbation, especially if done every day or even several times a day, can cause chronic fatigue, sleep disturbances, and a decline in the quality of the immune system. I once treated a 63-year-old female patient from Oregon who came in with complaints of muscle pain and fatigue that wouldn't go away. After several consultation sessions, it was revealed that she masturbated twice a day to relieve her anxiety. He didn't realize that his body was working too hard for such a seemingly simple process. Moreover, if masturbation is used as an escape from stress without being accompanied by healthy emotional solutions such as moderate exercise, meditation, or social interaction, then the real problem, loneliness, anxiety, or depression, is never really solved. Instead, an emotionally and biologically unhealthy pattern of dependency is formed. Masturbation becomes an addiction, not a comfort. 2. Using rough techniques like when you were young. In your youth, your body may be able to tolerate a fast, vigorous, even somewhat rough style of masturbation. But after the age of 60, the same technique can actually be harmful. This is one of the most common mistakes I see in elderly patients, especially men. They are used to the old ways that feel normal, even though the condition of the skin, blood vessels, and nerve tissue is much different. The skin is thinner, more sensitive, and prone to irritation or injury. In fact, in some cases, I have seen patients experience blisters and even minor infections because they were too hard or rushed in the masturbation process. I am reminded of a man named Mr. Alan Brooks, 70, from Phoenix, Arizona. He came in with complaints of stinging and mild swelling in the genital area. Upon examination, it turned out that the cause was very simple. He was using overly aggressive movements, like when he was in his 30s, without any lubricant or relaxation techniques. He thought it was normal, but his body was signaling otherwise. For women, this mistake is also common. Many older women still use too much finger pressure on sensitive areas, even though the production of natural lubricant has greatly decreased with age. Without the help of additional lubricant and a gentler approach, the result can be pain, stinging, or even micro-injuries that are not immediately noticed. A change in technique doesn't mean less pleasure. In fact, by getting to know your body better, you can find deeper comfort. Masturbation in old age should be a gentle, mindful experience that is in tune with a body that has gone through many phases of life. It's no longer about speed or intensity, but about quality and safety. 3. Ignoring heart condition during climax. Did you know that when a person climaxes, either through sexual intercourse or masturbation, the body experiences a surge of physical activity similar to mild to moderate exercise? Heart rate increases, blood pressure rises, and breathing becomes faster. For young and healthy bodies, this is not a problem. But for seniors who may have a history of heart disease, hypertension, or high cholesterol, this can be a trigger for serious harm, especially if done without preparation or medical supervision. Many seniors don't realize that masturbation, especially when done in uncomfortable positions or when the body's exhausted, can increase the risk of sudden cardiac arrest. I once handled the case of a 68-year-old man from Seattle, Mr. Donald Harris, who suddenly collapsed in the bathroom after climaxing. Upon further examination, it was discovered that he had a mild heart arrhythmia that had gone undiagnosed, and the uncontrolled sexual activity had exacerbated the condition. Unfortunately, because masturbation is considered private and shameful, many older adults do not share this habit with their doctors. Yet with open information, doctors can provide guidance such as safe body positions, duration of activity, and signs to watch out for, such as chest pain, sudden dizziness, or shortness of breath during or after masturbation. It's important to understand that reaching orgasm brings emotional and psychological benefits, but in older age, the process of climaxing should be done with full awareness of the body's condition. If you already have heart problems or high blood pressure, you should consult your sexual activity, including masturbation, with a trusted medical professional. Your health is more important than unnecessary embarrassment. 4th, using the wrong lubricant. After the age of 60, the body naturally undergoes physiological changes, including a decrease in the production of natural lubricants in both men and women. So the use of lubricant during masturbation becomes not just a convenience, but also a necessity. However, a common mistake is to choose a lubricant without paying attention to the ingredients, type, or compatibility with the skin condition of the elderly. Some even use products that are not designed for the genital area at all, such as hand lotion, baby oil, or petroleum jelly for practical reasons, without realizing the risks. One of the cases I remember was Mrs. Linda Watkins, 65, from Minneapolis. She came to the clinic with complaints of severe irritation in the genital area, accompanied by itching and burning. Upon investigation, it turned out that she was using a scented body lotion containing alcohol and perfume for masturbation. The product is safe for the skin of the hands or feet, but not for the sensitive tissues in the intimate area. The result? Skin inflammation, a mild yeast infection, and weeks of discomfort. Inappropriate lubricants can cause a variety of problems, such as allergies, irritation, fungal or bacterial infections, and even small cuts that are invisible to the eye. Especially in older people's thinner and more fragile skin, This risk is much higher. Some oil-based lubricants are also unsafe when used in conjunction with latex aids, as they can damage the material and cause excessive friction. The best option for older adults is a water-based lubricant that is free from alcohol, perfume, and harsh chemicals. There are also special lubricants for the elderly that contain aloe vera or natural ingredients to maintain moisture without causing irritation. If in doubt, consult a pharmacist or doctor first. The point is, don't take lubricants lightly. Choosing the wrong one can turn what should be a comfortable experience into an annoying health problem. 5. Not paying attention to prostate condition. For men over the age of 60, prostate health is very important, but often overlooked. The prostate naturally enlarges with age, a condition called benign prostatic hyperplasia, BPH, or benign prostate enlargement. Although common, this condition can cause problems such as frequent urination, weak urine flow, or a feeling of incompleteness after passing urine. Unfortunately, many men continue to masturbate with their usual intensity and pressure without realizing that it can worsen BPH symptoms or even trigger prostate inflammation, known as prostatitis. One of my patients, Mr. John Ellis, 72, from Denver, complained of dull pain in the perineal area, between the anus and scrotum, as well as difficulty urinating. At first, he thought it was just fatigue, but upon further examination, it turned out that he had mild prostatitis triggered by repeated pressure during masturbation without adequate warm-up, hydration, or pauses. He didn't realize that at his age, sexual activity needed to be adjusted, including paying attention to the frequency and mode of stimulation. Masturbation itself does not cause problems with the prostate if done correctly. In fact, in some cases, regular ejaculation can help clear the prostate ducts and lower the risk of prostate cancer. But if done too often, too forcefully, or in a prostate condition that is already problematic, it can cause inflammation, swelling, and infection. So it's important for older men to pay attention to the body's signals. Is there pain after ejaculation? Is urination noticeably impaired after masturbation? Is there a change in the color of the urine or semen? If so, consult immediately. Don't wait until the symptoms are severe. Remember, sexual health also includes taking care of the internal organs involved in the process. Neglecting the prostate can have an impact on the overall comfort of life. 6. Masturbating in the wrong position. When you are young, your body may be able to linger in various positions without complaint. But at the age of 60 and above, the choice of position when masturbating needs to be a serious concern. Many seniors are still used to doing it while lying on their sides for too long, sitting too hunched over, or even standing for too long in the bathroom. These positions, if repeated, can cause excessive pressure on nerves, muscles, and blood vessels, especially on the lower back, hips, or knees that have begun to weaken with age. I still remember my patient, 66-year-old Mrs. Carol Jennings from Boise, Idaho. She came in complaining of prolonged tingling in her left leg and persistent low back pain. After a fairly private and open discussion, it was revealed that she used to masturbate sitting on the bathroom floor, bent over with no padding. This position put constant pressure on the lower spinal nerves, and in the long run caused a mild nerve disorder that affected his mobility. Incorrect body positioning can also lead to impaired blood circulation. For example, sitting on a hard surface for too long can compress the blood vessels in the thighs and buttocks, triggering tingling and even increasing the risk of blood clots in individuals with a history of varicose veins or vascular disorders. What can be done? Try to masturbate in a comfortable place, such as a bed with soft pillow support for your back. Avoid holding the position for too long. Listen to your body. If you feel uncomfortable, don't force it. Sexual activity should be a moment of relaxation, not a cause of muscle tension or nervous disorders. In old age, comfort and safety should be the top priority. There's nothing wrong with adjusting techniques and positions to maintain long-term health. 7. Ignoring emotional aspects and guilt. Behind the physical act of masturbation is an aspect that often goes unnoticed: emotions and mental health. Many seniors have grown up in cultures or religious backgrounds where masturbation is taboo, dirty, or even shameful. As a result, even if they do it, There is guilt that comes afterward, guilt that can creep up silently and affect their overall psychological state. I once treated a 69-year-old woman from Charleston, South Carolina, Mrs. Evelyn Carter. She came with complaints of mild depression, sleep disturbances, and low self-esteem. Over several counseling sessions, it was revealed that she masturbated regularly, but always cried afterwards because she felt guilty. For decades, she carried the belief that such personal pleasure was not appropriate for a widow of her age. In fact, medically speaking, the activity can actually be beneficial for maintaining mental health and hormones. But the guilt makes her body experience additional stress every time she does it. Seniors need to understand that age changes do not eliminate the need for intimacy, both physical and emotional. Masturbation can be a means of releasing tension, recognizing the body, and providing a sense of comfort, especially in the absence of a partner. But if done under the shadow of guilt or fear, the benefits can turn into a psychological burden. It is important to make room for self-acceptance. If necessary, talk to a therapist or counselor with experience in sexual health in older age. Guilt is not part of this natural process, but a reflection of a lack of education and social acceptance that is time to change. Remember, sexual health is not just about the body, but also about the heart and mind. Keeping them in harmony is the key to enjoying life to the fullest, even at the age of 60 and above. When silence becomes a silent threat. Imagine those quiet nights when the ticking of the clock sounds louder than usual. The kids are busy with their own lives. Your spouse, perhaps, is gone, and you sit alone in your living room with silence hanging in the air. There's nothing wrong with enjoying solitude, but when the loneliness becomes overwhelming, the body and mind begin to seek escape. And for many seniors, that escape is masturbation. It may feel lighthearted at first, a way to fill a void, cure a longing for intimacy, or simply release physical tension. But without realizing it, when done the wrong way, this escape slowly turns into a trap. The body starts sending signals: muscle pain, difficulty sleeping, increased anxiety, even tightness in the chest after climax. But who to talk to about this? In our younger years, we often think of sexuality as a right, but in old age, many feel it's something to be kept close, even to themselves. And herein lies the tension. The desire is still there, but the body and mind have changed. Meanwhile, society is silent and shame binds the tongue. It's not just about faulty technique or lack of information. It's about how a natural need can turn into a source of guilt, fear, and even health risks if not handled wisely. Every elderly body has a story to tell, but too many of them are kept in silence, slowly suppressing the soul. When masturbation becomes the only escape, and it's not coupled with an awareness of the body's health and emotional support, then what should be solace can instead turn into a frightening threat. When health threatens, life changes. One night, Mr. Richard Thompson, the man I told you about earlier, a 67-year-old Navy veteran, suddenly woke up in the middle of the night. His heart was racing, his breathing was labored, and he felt a sharp pain in his left chest. In shock, he could barely move. For the past few weeks, he had been feeling unwell, but he didn't think this would be the peak. The physical tension he felt was not due to age or fatigue after a long day. It was the result of his nightly masturbation habit to relieve stress, without regard for his body and heart health. That's when he realized that his neglect of his body and emotions, which he took for granted, was leading to a crisis point. He was rushed to the hospital and thankfully, he survived. But the incident opened Richard's and my eyes to a reality that many people often forget. Sexual health is not separate from overall physical health. When we neglect our bodies or use methods that are inappropriate for our physical condition, we can risk creating much bigger problems than we imagine. Many older adults feel as though they are trapped in a world that is changing so rapidly. They feel anxious and confused about how to treat a body that is no longer what it used to be. And more often than not, they don't know what to do when habits they thought were safe for years turn out to be harmful. It was only during Mr. Thompson's panic attack that he realized that the masturbation he had thought of as a lighthearted escape had a much deeper impact. If not addressed in the right way, a habit that seemed like a personal need could end up posing a serious health threat. Conclusion: respect the body, respect yourself. What we learn from Richard Thompson's story, as well as from many other seniors struggling with similar issues, is that sexual health in old age should not be overlooked. Masturbation, often thought of as a way to relieve tension or loneliness, can have a huge impact if done in an unwise manner. Seemingly trivial mistakes, such as doing it too often to relieve stress, using rough techniques, or ignoring medical conditions such as heart and prostate health, can affect your quality of life more than you think. Remember, your body is not the same body it used to be. As we age, physical and emotional changes become part of life's journey. However, that doesn't mean you have to sacrifice comfort or health to fulfill legitimate personal needs. Instead, it's the perfect time to take better care of yourself, to learn to listen to your body, to seek healthier alternatives, and to find safer and more comfortable ways of maintaining sexual well-being. Time to change for better health. Don't let long-standing habits rule your health. It's time to act. If you feel these concerns are relevant to you or someone you know, don't hesitate to seek help. Start by consulting a doctor or sexual therapist who is experienced in dealing with sexual health issues in older age. They can help you devise a plan that is safe and suitable for your body condition. Use safe lubricants, choose comfortable positions, and don't hesitate to reduce the frequency if your body is already signaling for rest. Supporting each other and talking about this topic is also very important. Maybe you're not the only one who feels confused or embarrassed. Let's change the stigma and build a better understanding of older people's sexual health. You deserve to live comfortably, safely, and with the best quality of life, both physically and emotionally. Don't wait for problems to arise. Take action now before there is a greater risk to your health. You are valuable, and your health is a priority.